Hello. I will be talking to you today about therapeutic riding and hippotherapy and the approach we call hiker. So the notion of the benefits of the horse to the human body come from the ancient times, from Hippocrates, from the 5th century, and then they have many references have been made to the benefits of horseback riding. And further along, from Lord Thomas Sydenham, he was the first to say that the horseback riding and the horse doesn't only help the body but also the soul. Tissot was the one to say that it's the gait of the horse and its movement that is what is beneficial to the body. And in the beginning of the 1900s, Dame Agnes Hunt was the first established orthopedic who used horses as a rehabilitation method. Despite all of the references in history, it was very hard to make horseback riding a therapeutic method and make it accepted. But after Liz Hartle won second place in the Olympics, she was infected with polio. So after the concerns of her doctors, who she continued riding, and she won the Olympics, people became physiotherapists became interested and started looking at therapeutic programs for horses. Why we use a horse as a therapeutic animal? Well, first of all, it's a friendly animal and it enjoys human contact. But also, and most importantly, it mirrors its rider's feelings. So even a small change in the emotional state of its rider will be seen in the horse's behavior for us to understand what the rider is feeling. The horse can set direct boundaries for its rider, so they're both clear on their relationship and what is acceptable and what is not. Also, the horse is a perfect non-judgmental creature. Since 1983, in Greece, there had been many attempts for therapeutic riding to become a known form of therapy, but it was unsuccessful. And it was only in 2004 that there was a group of professionals such as physiotherapists, occupational therapists, speech therapists, psychologists, and special educators that managed to create a group, an established group, and use the horse as a therapeutic method. It was later named the Greek Scientific Association of Therapeutic Riding and Hippotherapy. It is the biggest in Europe, and it uses an approach called hiker approach. There's a difference between therapeutic riding and what we call hippotherapy. So for therapeutic riding, also known as equestrian therapeutic education and gymnastics, the aim is for the rider to gain all the benefits related to the horse's movement, and also the relationship between the horse and the patient, as well as gain benefits from the surroundings where the riding takes place. For a therapeutic rider, the benefits are mostly pleasure and entertainment, as well as socializing, improving exercise skills and movement, so muscle control, but also just simply learning the sport in a safe environment. Therapeutic riding is taught by special education horse trainers, social workers, and people of other professions in that field. Hippotherapy is different. It is used for the rehabilitation of people suffering from neurological disorders, like cerebral palsy, multiple sclerosis, different myopathies, and others, as well as as well as disorders such as autism spectrum, ADHD, mental and psychomotor retardation, learning difficulties, behavior, speech and language disorders, other disorders such as Down syndrome. These hippotherapy includes regular treatment sessions, so it's similar to the conventional treatments that happen in rehabilitation centers. Only the space is different. It is the equestrian arena, and then the agent changes, which is the horse. The therapists have do patient evaluation and assessments for each patient. They keep the treatment protocols and they set treatment goals. So basically, we do on the horse, why we have a patient on the horse. We do all the treatments we would do in a normal therapy room, but on a horse. So occupational therapy would take place on the horse. So several benefits that come from hippotherapy are an increase in muscle coordination, an improvement in gross and fine motor skills, eye and movement coordination is improved, as well as balance and gait of the patient. There is an increase in concentration and attention, especially in children, and the cognitive skills are expanded depending on the exercises we do. And also speech and communication improve, as well as there is an increase in social skills, self-esteem and confidence, and again mostly in children. This is just a graph that shows the differences between hippotherapy and therapeutic riding. This is just a small picture of some of the toys we use. You can see they're all very colorful, and we have different rings that the kids use to, they have to stretch and put them on rods so they can, what's happening? I'm sorry. They stretch and put them on rods. We use baskets for the kids to play with balls and different animals, and we have balls with different textures for sensory, different sensory stimulus. And this is just an example of some of the things you can find in the therapeutic arena. So we use a hiker approach, which is a holistic approach to therapy riding, and it's based on the ability of the brain to change and modify, both in its structure and its operation mode. This happens in two ways, either by modifying the existing neural circuitry or by creating a complete new neural circuit. The main factor creating these modifications is the diverse stimuli found in the environment. So it's always outdoors, there's always trees and birds chirping, and it's always calm, and the colors are all nature colors, and we also have the vibrant colors coming from the toys, and then different animals are usually around where the arena we have, sometimes we have goats or dogs, or so that it's a very diverse, we have a lot of different stimuli. The stimuli the participants experience act on their body in all different systems, sensory, emotional, cardiovascular. And the way to change these, to make these modifications I talked about above, we use the incentive for the kids, which is the toys, that keeps them interested and which strengthens their learning process. And then repetition is very important, which is what creates what helps the neuroplasticity process. So this is just a general phrase for the philosophy of hiker. It is the creation of appropriate conditions for the interaction between patient and surrounding environment, which promotes motor, perceptual, social, emotional, and cognitive learning, and facilitates a multi-dimensional development of the patient. So this is the hiker philosophy in like a phrase. A hiker therapist is specially trained and must have specific qualifications. So one of the important ones is the therapist must have knowledge of the anatomy and kinesiology of the horse, so they can understand what happens with the gait of the horse in different, so when it walks or when it runs, and the anatomy, so they can decide where the patient will sit on the horse, so lower in its back or higher up, which helps depending on what stimuli you want to transfer from the horse to the patient, depending on how fast the horse runs, for example, or how slow, it transfers different stimuli. The therapist must be able to assess and record the clinical condition of the patient, design a personalized therapeutic intervention program, and establish therapeutic and operational objectives for the individual patients. So these qualifications are similar to the ones a therapist should have in a therapy room in a conventional rehabilitation center. Of course, the therapist should have respect for the particularities of each patient, and he should be able to promote movement, communication, independence, cooperation, stability, initiative, respect, and self-discipline throughout the session. So for each, when a session is conducted, we have a horse, and then a handler who guides the horse around the arena, and then we have two therapists along each side of the horse. We have the therapist A, who is responsible for that particular patient. He is the main therapist. And then therapist B. Before a regular session begins, therapist A must obtain a patient's history, make an assessment, and design a rehabilitation program for that specific patient. Therapist B will contribute to that assessment and will help set the goals for that child. After the sessions have started, and before and during each session, therapist A will plan out the session, will choose the horse, and then throughout the session will decide what horse gait to choose, and will instruct the the handler. And then the therapist A will select what kind of therapeutic gear he will use for each patient. So, for example, in order to have more stimulus transferred from the horse's movement, we will use pads on the horse's back instead of a saddle, because the saddle, you lose most of the movement from the horse. And then therapist A will also inform the therapists that are involved in the session about the course and the progress. Therapist B is there mainly for the safety of the patient that is on the horse, because therapist A will be doing all the different activities, so it won't be necessarily next to the child on the horse. Therapist B will also actively participate in those activities inside the session, and will also carry the materials back and forth, so the toys and the rings and the rods and the baskets and all that. The horse handler is also very important in a therapy session. He is the one responsible for the safety of the therapists and the horse. He must be aware of the specific distances he will keep from other horses and other obstacles inside the arena. He is responsible for the speed and quality of the horse's gait, so depending on what the therapist A has instructed and what he needs for that particular session, the horse handler must be able to do that and keep the correct speed. The horse handler is also responsible for changing courses inside the arena depending on other horses, because usually there's more than one horse working at the arena. And again, back to safety, you must always keep in mind that behind him is a very big volume of the horse and the two therapists, and must always leave enough space for them to walk safely and freely around the arena. The horses we use for hippotherapy are specially trained by the therapists, and it happens in 6 stages. First, we have to make the horse comfortable with having people along each side of them and in front and behind it. And then we must make, usually how we do it is make different noises. We stand next to the horse and make really loud noises or abrupt movements, which is an example of what a patient might do when he is not calm when first riding a horse. And we have to get the horses familiar with the therapeutic materials that we use, so the balls, the toys, the noise, We have big rods we use for the rings, which sometimes they perceive it as a whip and they get scared, so we have to desensitize them to that. Here's a picture of this is one of our horses. This is Dolly, and we're using the ball. So we put it next to her hind legs, we touch her with it, and then near her face. And then we have a therapist sit on and pretend to be a patient, and then we make the therapist change positions on the horse, which is something the patient would do. And then we start walking the horse around the arena with both therapists and the handler in front. And so by doing this, the handler and the therapist, we can all understand and see the behaviors each horse will have in different situations. So the handler will be able to assess the situation and predict the behavior of the horse, so they will be able to prevent, for example, a horse being startled. And after all 5 steps are finished, it is only then that we introduce a child or a patient on the horse. So for example, this is an example for neurological disorder. Say for a child with hypertonia, where the muscles are very constricted and rigid, the therapist would have to select a narrow horse with a narrow back, so that the opening of the legs would be easier for the child on the horse, and also probably a shorter horse rather than a tall one, so we can help the child keep the correct posture on the horse. So the gait would depend for each session depending on what we want to work on and what muscle groups. There are many different positions that we might have a child sit on the horse, and here are some of them. This is the normal riding position, and then sometimes they sit on the side or backwards, or also this one, which is they lie on their stomach on the horse, or they lie back, they kneel, they sit on all fours, they stand up. They do this other thing that we call bear position. All these different positions give different stimuli to the body, depending on the movement of the horse. All of these positions, usually the horse's gait is slow, so he walks very, very slowly, just for safety, and also to get the better feel of the movement inside the body. Oh, here's a picture of a little guy we have standing up, so it's an actual picture. But sorry, before I go there, there you go. Also, selecting the proper equipment would be very important for a child with a neurological disorder, or any child. We rarely use saddles because it interrupts the movement, the feel of the movement. But sometimes, we also use that. Pads depend. We use more pads. We use padded pads, if that makes sense. And also, for each child, we set therapeutic goals, so to help them improve their muscle tone, their posture, strengthen their core. And this is all for this particular example. So for other children, we would have to focus on therapeutic goals, such as working on eye contact, and maybe improve speech, and also then we set functional goals for each child. So for a child with neurological disorder, we would try, and a functional goal would be gain in muscle control. Or for a different child with, let's say, autism, it would be learning how to ride the horse. So we would give them reins and teach them how to use the horse functionally and try to drive it around the arena. So finally, I have just a few pictures that show how we play with a child on the horse. Usually when we do different games, we we turn the child to sit facing the back of the horse, because we have more space. So one therapist can sit behind the horse, and then we play ball, and depending on how they stretch, we work on their core strengthening, which helps in balance, improves their balance, and improves their posture generally. And then in the other picture, we use rings. Well, in that picture, we don't have the rod, but we have a big rod, and then we move it around depending on what we want the child to do. So just the conclusion is that hippotherapy is very versatile. We can use it with children of many different disorders, and it is adaptable for each child, and has several benefits that are social, cognitive, and physical. Physical from the movement of the horse, cognitive from some of the exercises that we do in the activities, and then social just by so a shy child, just by having the contact with a horse and that trusting relationship, they become more open. We don't have any restrictions for age. We usually have children, but we do have some adults. Our youngest child is 2 years old, so just as long as they can sit, they can be on the horse. And that's it. Any questions, if anyone has any?